second wave that everybody told us about is upon us. Our job as government and your representatives are to make sure that it impacts Fort Lee as least as possible. I've always been a big bragger about Fort Lee and where we are with the numbers. I'm looking at our COVID chart where we were at 229, 250, and then in May and June and July, we just stopped the spread. We did a great job with 17, 20 positive counts in a month. We're already at 60 positive cases from November 1 to November 12. And if you extrapolate those numbers, you're talking about well over 100 for the month. So the second wave is hitting Fort Lee as well.
From March until present, there is a total of 740 confirmed COVID-19 cases in Fort Lee. There are 49 deaths. That death count has remained stable for some time. But with that being said, the precautions that the Fort Lee community is putting into place does make a difference. With the high population density in Fort Lee and the high-rise living, the case count could be much higher. So, please know that what you are putting into place is helping to keep the case count down.
Over the past few months, I'm happy to report Fort Lee's tested over 4,000 people. We've sponsored drive-through flu shots. We've distributed thousands of masks, t-shirts promoting mask wearing.
If you test negative on day 7, that doesn't mean that at that point you discontinue your quarantine. You have up until the 14 days because on the 14th day, you might develop symptoms. If you had potential exposure and you go for a rapid antigen test and test negative, the PCR test should follow that rapid antigen test because the PCR test is the gold standard and it is the confirmatory test.
I want to reassure the borough that the Fort Lee Police Department, I think I could take the liberty of speaking for the entire emergency services, are ready and willing to respond to any emergency, whether it's COVID related or not. Over the last 8 months, we've had a tremendous amount of cooperation from all of our citizens and businesses. To date, we've had no, through our department, issued any violation of any executive order. We've taken the approach when we do receive complaints to reach out to that business usually and provide some education through the health department and any other department, and almost 99% of the time we receive compliance.
Here at Borough Hall, we've installed a telephone system from outside. We're handling all of our, whether it's a tax payment or whether it's a visitor who has a court question. We are relying upon the telephones a little bit more and email, obviously, but we're still here, we're still working.
At this point, if you are not listed and have subscribed to Nixle, please, I implore you, we're in a pandemic, it's your civic duty to do so. You are going to text your zip code 07024 to 888-777.
Just wanted to inform everybody that wear your masks, stay safe, and hope we have some good questions also.
We were considering whether or not we could adopt a local ordinance to impose a fine for those people that don't wear masks, quite frankly. And I'm not a fine guy, right? I'm not looking to get unelected, but nothing makes me, or the group that I'm with here tonight, and I speak on all of their behalves on this issue, nothing makes me more irate than people that are selfish and don't wear masks. You got to report it immediately to management. It is a violation, a flagrant violation, not to wear a mask.
The biggest thing we can do, and if you want to share privately, you could share which building it is, and we can maybe help management. But we need to educate folks and keep educating folks. So that they need to wear masks and social distance. So, like the mayor said, I don't think there's anything we can do out there and go and fine anybody. But we just need to keep reinforcing and make sure that the building has the signs up to practice the social distancing and wear the mask, and just keep pushing it out there to people, and hope that their civic duty would make them wear that mask in the future.
The rate of transmission isn't calculated on a municipality level because you wouldn't gain anything meaningful from it. It wouldn't provide accuracy. So it is, statewide, they do calculate the rate of transmission. And I know as of today, I think it was reported to be 1.30. So, anything above 1 indicates community spread. So That is where it stands currently in New Jersey. You want that below 1, and right now we are not.
The enforcement inside each individual business is the responsibility either of that business owner or that building property management or anything like that. If the police do get called on that, we kind of go there and give the owner or the management of that establishment some education, go over the executive orders with them, whether they need to post some signs or have some more diligence in enforcing that, and that's what we try to do. And we usually get compliance if the complaint comes to the police department. As far as enforcing with fines and stuff, that's a little problematic the way the executive orders are structured.
Bottom line, wear a mask. If you don't wear a mask, in my book, you're selfish. Please, I implore you, if you don't want to do it for yourself, do it for everybody else that's scared to be around you. It's not fair.
To find testing sites, it's nj.gov. Go to the COVID-19 information hub, type in testing. The ones in the area would be in Edgewater, North Bergen, we're aware of. There may be a possibility that Prompt MD in Fort Lee is testing, but that's you would have to call and verify that.
We're actually in contact with the county because we're trying to get their mobile unit back here. We've already had them here a couple days.
Laws prohibit identification or numbers by address in municipalities. It's just not provided on that type of address level.
It was 2 or 3 months into the pandemic that our own police department was only able to find out whether or not they were going to a call that had a potential COVID situation. Correct, Chief? I mean, maybe not that long into the pandemic, but you know, the HIPAA rules are very restrictive. I mean, look, they are there for a reason. I agree, but I agree with your question, Helen, I really do. We just do not have access to that information. We do not.
The cases don't come in by address. They do come in, case by case. It's not itemized by address. In the past, we have, in the health department, for our own information, have created spreadsheets just to determine, numbers across buildings. But we don't have that percent, how many are in high rises as opposed to single family homes.
And I am by no uncertain terms am I suggesting that there's a higher propensity in high rises, but we got to all use common sense, right? We now know that being in indoor areas, there is the potential to contract this virus. We know being around a lot of people at any one time, there's the potential to contract this virus. So, high rises do create and have an environment that would put them at potentially a higher risk. I mean, that's my non-expert opinion here, and we don't have that statistic. And I think a lot of apartment dwellers in the borough of Fort Lee need to be extra careful, which makes me that much more irate when I hear about somebody walking into an elevator without a mask.
We're going to take it into consideration and possibly push those numbers out there on our website. But just so you know, in the meantime, Bergen County is pushing it out town by town, and you can visit their website, and the county executive Tedesco has been very forthcoming in making sure that the transmission rates in the county and each individual town and their numbers are posted daily.
Unfortunately, we are required to follow the state of New Jersey's lead. We do and are responsible for a lot of the enforcement activities, so we do try and err on the side of caution when it comes to shutting a place down or not. We're very mindful of the business relationships as well as the businesses here in town. The first priority, of course, is everyone's safety. So that is a priority, but we are meaningful of the downtown and of the many businesses that depend upon Fort Lee.
I can tell you that there are a host of liability problems with all of that, with a municipality assuming that responsibility, but I gotta tell you, I think that is a great idea, and it's something that maybe we should consider implementing. And it's not a question of trying to discourage people from going somewhere, but at least they need to know, for example, if over the last 30 days spot checks, there have been no incidents, you get a level A. Or if there's only been one incident of a violation over a certain period, you get a level B, and that type of thing.
The governor made an avenue for residents of the state to go to the state webpage and you'll be able to locate these grocery stores, just what you're asking for, who's in compliance and their ratings and so on and so forth. I mean, we all want to encourage to shop locally and help these local businesses during tough times, but to your credit, and it's a very good point, if you wanted to see which stores were fulfilling their obligation more than the other ones, the governor did just create a porthole on the website for this very thing.
The airlines have it where there is voluntary reporting when you're entering New Jersey from a state on the advisory list. And then that comes to the state health department, to the county health department, to us at the local. So if someone voluntarily does fill that out, we are made aware and we make the contact to them to, again, reiterate the quarantine advisory. But if building management is aware that residents are driving in from states on the advisory list, then we will go forward and work with, they can provide us that individual's information and we'll do the same. We'll contact that resident and advise them of the quarantine.
We started with Frank about the person that went to the elevator without a mask. We get to Andrea that talks about people that have been to Florida and they're not quarantining, or they're not doing that. Yeah, they're not doing their 10-day voluntary quarantine. And then there were a few other questions about people not in the supermarket wearing it. And the overall theme is, what is it that we could be doing about it, right? And number one is information. Number two, we'd love nothing more than to have the enforcement powers, but we don't. We don't have, Chief, unless you tell me differently, we don't have the power to arrest here. I mean, I'm not suggesting we want to go and arrest people, but it would be a great incentive to that 1% that just persists in not complying with these warnings from the governor and from the CDC, and it becomes very, very frustrating. Andrea, I know many, many people that are back and forth to Florida that don't quarantine. And frankly, it's not fair. It really isn't, especially for those that do comply. We did a drive-through testing facility in Fort Lee that, other than the mobile unit, we probably did thousands through our drive-through unit. Number one. Number two, I'm not aware of, is there one in the county that's drive-through?
No, there's no mobile right now.
Yeah, see, the county is only sponsoring their mobile unit at the moment, where they come to a particular town, and then at that point they do their testing. So I'm not aware of a mobile unit. Jill, no, right? We're not aware of any mobile units that are out there. I agree with you, by the way. To me, it's the most safe and most comfortable way to do it.
I think we're cautiously optimistic as far as the vaccine is concerned. Obviously, we're looking forward to it. We've heard a lot of different things on both sides as far as who's going to get it right away, who's has some concerns.
We're even hearing about some great therapeutics that are coming around. But that shouldn't allow us to now put our guard down, because that's forthcoming. I mean, by the time we in Fort Lee have access to that vaccine, and I'm only guessing, but you're talking probably months and months and months from now. And now it's a tough part. So now we really got to dig our heels in and be smart here.
We have not had cases where we've had clusters for indoor gatherings. One of the items we have noted are sports related cases. That's something that we've noted here in Fort Lee. As far as, percentages and so forth of that, we don't have, but that's a lot of the reporting, is that there was a positive case at my place of employment, and therefore I test it, and that's how we're, that's reports that we're receiving.
There's no more, you got to search long and far to find out about somebody that died. Now it's everybody. There's no one on this call, there's no one in this town that doesn't have some type of contact to somebody that's lost their life, or a family that suffered as a result of loss of life. And that should be enough incentive.
So the health department is working very closely with the school system. We're in contact daily. The nurses are heavily monitoring symptomatic individuals, and we handle it each by a case basis and a school basis. So you might be aware that the middle school and the intermediate has gone remote, and that was just based on monitoring. and making that decision there. As far as the statewide, there's a COVID activity level report that comes out, and that also plays into school closure. We went from low in the summer months, now we're at moderate activity level. And with that, there is different guidelines to follow for closures and for actions taken in the school related to COVID. And then, once we get to a high level and a very high, it's, definitely all virtual.
The governor even stated today that there is no intentions as of yet to go fully remote again in the state of New Jersey. And we hope that, as we hamper down the virus, that we continue that way.
When somebody tests positive, there's immediately an interview that's conducted to determine whether or not there's been close contact with other individuals. We then go to great lengths to contact those individuals. And look, I think I'd be remiss in not saying there are flaws in the system, but we're proud of the contact tracing that we're doing here, and just stay tuned and we're going to get through it. These tents now are going to start having walls, those plastic walls. Once those walls come down under the fire code, the electric code, the plumbing code, those are treated like indoor areas. So they need to have ventilation, exit signs need to be posted, and there needs to be a form of heat. And that can't be a propane heater in an enclosed area.
We've had our representatives from the building department, we've had representatives from the Fire Prevention Bureau go out, visit these restaurants, go over a plan and try and help them, to the best of our ability, ensure that they have a viability through the winter, which we know it gets a lot tougher.
The task force is continuing to meet daily and go over some of the operations that we performed during the first wave to help us hamper down the second wave again. The emergency services are well prepared, our PPE is stockpiled, and we are here to answer any COVID-related calls or non-COVID related calls. Please continue to practice social distancing, wear your mask, wash your hands, and please, that will help us hamper down the second wave of the virus. The governor has been issuing and is continuing to issue executive orders that we will be able to answer for any of those questions tonight. But Fort Lee, we will get through this together, and please stay safe.